A. Medical dictionary, medical terms, words, spelling, and definitions. Abacterial, Abacterial. Abacterial, abacterial, Abacterial. Abacterial, abacterial, Abacterial. Abacterial, abacterial. Any atmosphere or condition free of bacteria, literally without bacteria. Abacterial. Abasement, abasement, Abaissement. Abasement, abasement, Abaissement. Abasement, French, a lowering. 1. A falling or depressing. 2. In ophthalmology, the displacement of a lens. Abasement, Abaissement. Abasement. Abalienation, abalienation, Abalienation. Abalienation, abalienation, Abalienation. Abalienation, abalienation, Abalienation. Abalienation. 1. A state of physical deterioration or mental decay. 2. A state of insanity. Abalienate, verb, abalienated, adjective. Abalienation, Abalienation. Abalienation. A-band, the letter A, and then band, B-A-N-D. A-band. A-band, the area between two I-bands of a sarcomere marked by a partial overlapping of actin and myosin filaments. A-band, the area between I-bands of a sarcomere marked by partial overlapping of actin and myosin filaments. B-A-N-D. A-band. Abapical. 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 Opposite the apex. Abapical. 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 Opposite the apex. Abapical. Aberranosis. Abaragnosis. Aberranosis. Aberranosis. Abaragnosis. Aberranosis. Aberranosis. Abaragnosis. Aberranosis. Greek a, not, baros, weight, gnosis, knowledge, an inability to judge or compare the weight of objects, particularly those held in the hand. Aberragnosis. Abarognosis. Aberranosis, an inability to judge or compare the weight of objects, particularly those held in the hand. Abarticular. 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 1. Pertaining to a condition that does not affect a joint. 2. Pertaining to a site or structure remote from a joint. Abarticular. 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 Abarticular gout. Abarticular. Abarticular gout. 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 Abarticular gout. Abarticular gout, Latin ab, away from, articulus, joint. Gout symptoms that affect tissues other than joints, such as ligaments. Abarticular gout. Gout symptoms that affect tissues other than joints, such as ligaments. Abarticular gout. Abarticulation. 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 1. Dislocation of a joint. 2. A synovial joint. Abarticulation. 1. A dislocation of a joint. 2. A synovial joint. Abarticulation, dislocation of a joint. Abarticulation, dislocation of a joint. Abarticulation, a synovial joint. Abarticulation, a synovial joint. Abasia, A-B-A-S-I-A, abasia, A-B-A-S-I-A, abasia, A-B-A-S-I-A, abasia. Abasia, Greek a basis, not step. The inability to walk, caused by lack of motor coordination. Abasic, abatic, adjective. Abasia, A-B-A-S-I-A, abasia. Abate, abate, A-B-A-T-E, abate. Abate, A-B-A-T-E, abate, abate, A-B-A-T-E, abate. To decrease or reduce in severity or degree. Abate, to decrease or reduce in severity or degree. Abate, to decrease or to reduce in severity or degree. Abate, A-B-A-T-E, abate. Abatement, A-B-A-T-E-M-E-N-T, abatement. A-B-A-T-E-M-E-N-T, abatement. A-B-A-T-E-M-E-N-T, abatement. A-B-A-T-E-M-E-N-T, abatement. A decrease in severity of symptoms. A decrease in severity of symptoms. Abatement, a decrease in severity of symptoms. Abatement, a decrease in severity of symptoms. Abatement, A-B-A-T-E-M-E-N-T, abatement. Abatic, A-B-A-T-I-C, abatic. Abatic, A-B-A-T-I-C, abatic. Abatic, A-B-A-T-I-C, abatic, pertaining to an inability to walk. Abatic, pertaining to an inability to walk. Abatic, pertaining to an inability to walk. Abatic, A-B-A-T-I-C, abatic. Abaxial, abaxial, A-B-A-X-I-A-L, abaxial, abaxial, A-B-A-X-I-A-L, abaxial, abaxial, A-B-A-X-I-A-L, abaxial. Latin ab, axis from axle. 1. Pertaining to a position outside the axis of a body or structure. 2. Pertaining to a position at the opposite extremity of a structure. Abaxial, A-B-A-X-I-A-L, abaxial. Pertaining to a position outside the axis of a body or structure. Abaxial, pertaining to a position outside the axis of a body or structure. Abaxial, abaxial, pertaining to a position at the opposite extremity of a structure. Abaxial, pertaining to a position at the opposite extremity of a structure. Abaxial, A-B-A-X-I-A-L, abaxial. Abokinase, A-B-B-O-K-I-N-A-S-E, abokinase, abokinase, A-B-B-O-K-I-N-A-S-E, abokinase, abokinase, A-B-B-O-K-I-N-A-S-E, abokinase. A trademark for plasminogen activator urokinase. Abokinase, a trademark for a plasminogen activator urokinase. Abbott pump, A-B-B-O-T-T, Abbott pump, P-U-M-P, pump. Abbott pump, a trademark for a small portable pump that can be adjusted and finely calibrated to deliver precise amounts of medication in solution through an intravenous infusion set. It is similar to a Harvard pump, but the flow rate may be increased or decreased by smaller increments. See also Harvard pump. Abbott pump, A-B-B-O-T-T, P-U-M-P, Abbott pump. A trademark for a small portable pump that can be adjusted and finely calibrated to deliver precise amounts of medication in solution through an intravenous infusion set. It is similar to a Harvard pump, but the flow rate may be increased or decreased by smaller increments. See also Harvard pump. Abbott pump, A-B-B-O-T-P-U-M-P, Abbott pump. ABC, ABC, abbreviation for aspiration, biopsy, cytology. ABC, ABC, abbreviation for aspiration, biopsy, cytology. Abciximab, abciximab, A-B-C-I-X-M-A-B, abciximab, abciximab. a platelet aggregation inhibitor. Indications: it is prescribed as an adjunct to percutaneous transluminal coronary angioplasty or atherectomy. Contraindications: the drug may not be given to patients with active internal bleeding, recent gastrointestinal or urinary bleeding, or significant history of stroke, thrombocytopenia, or recent major surgery. Adverse effects: the side effects most often reported include bleeding, thrombocytopenia, pulmonary edema, atrioventricular block, and atrial fibrillation. Abciximab, ABCIXMAB, abciximab. Abdomen, 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 abdomen. Latin, belly, the portion of the body between the thorax and the pelvis. The abdominal cavity contains the inferior portion of the esophagus, the stomach, the intestines, the liver, the spleen, the pancreas, and other organs, also called informal belly. See abdominal regions. Abdominal, adjective. Abdomen, 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 abdomen. Abdominal adhesion, abdominal adhesion, ABDOMINAL, abdominal adhesion, 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 abdominal adhesion, ABDOMINAL, abdominal, adhesion, 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 abdominal adhesion. The binding together of tissue surfaces of abdominal organs, usually involving the intestines and causing obstruction. The condition may result from trauma or inflammation and may form after abdominal surgery. The patient experiences abdominal distension, pain, nausea, vomiting, and increased pulse rate. Surgery may be required. Abdominal adhesion, the binding together of tissue surfaces of abdominal organs, usually involving the intestines and causing obstruction. The condition may result from trauma or inflammation and may form after abdominal surgery. The patient experiences abdominal distension, pain, nausea, vomiting, and increased pulse rate. Surgery may be required. Abdominal adhesion. Abdominal aorta. Abdominal aorta. Abdominal, ABDOMINAL, abdominal aorta, 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 abdominal aorta, the portion of the descending aorta that passes from the aortic hiatus of the diaphragm into the abdomen, descending ventral to vertebral column and ending at the fourth lumbar vertebrae, where it divides into the two common iliac arteries. It supplies blood to the abdominal structures, such as the testes, ovaries, kidneys, and stomach. Its branches are the celiac, superior mesenteric, inferior mesenteric, middle suprarenal, renal, testicular, ovarian, inferior phrenic, lumbar, middle sacral, and common iliac arteries. See also descending aorta. Compare thoracic aorta. Abdominal aorta, ABDOMINAL, abdominal aorta, 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 abdominal aorta. The portion of the descending aorta that passes from the aortic hiatus of the diaphragm into the abdomen, descending ventral to vertebral column and ending at the fourth lumbar vertebrae, where it divides into the two common iliac arteries. It supplies blood to abdominal structures such as the testes, ovaries, kidneys, and stomach. Its branches are the celiac, superior mesenteric, inferior mesenteric, middle suprarenal, renal, testicular, ovarian, inferior phrenic, lumbar, middle sacral, and common iliac arteries. See also descending aorta. abdominal aponeurosis, abdominal aponeurosis, ABDOMINAL, abdominal aponeurosis, APONEUROSIS, abdominal aponeurosis, the conjoined tendons of the oblique and transverse skeletal muscles of the abdomen, abdominal aponeurosis, the conjoined tendons of the oblique and transverse skeletal muscles of the abdomen, abdominal aponeurosis, neurosis, ABDOMINAL, abdominal aponeurosis, APONEUROSIS, abdominal aponeurosis. Abdominal bandage, abdominal, 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 bandage, 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 abdominal bandage, ABDOMINAL, abdominal, bandage, 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 bandage. Abdominal bandage, a broad, absorbent bandage commonly used after abdominal surgery. Abdominal bandage, a broad, absorbent bandage commonly used after abdominal surgery. Abdominal bandage, a broad, absorbent bandage commonly used after abdominal surgery. Abdominal binder, ABDOMINAL, abdominal, binder, BINDER, binder. Abdominal binder, ABDOMINAL, abdominal binder, BINDER, binder. Abdominal binder. Abdominal binder, a bandage or elasticized wrap that is applied around the lower part of the torso to support the abdomen. It is sometimes applied after abdominal surgery to decrease discomfort, thereby increasing a patient's ability to begin ambulatory activities and accelerating convalescence. Abdominal binder. Abdominal breathing. Abdominal. ABDOMINAL, abdominal, breathing, 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 abdominal breathing, abdominal breathing, ABDOMINAL, abdominal breathing, 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 abdominal breathing, a pattern of inhalation and exhalation in which most of the ventilatory work is done with the abdominal muscles. The contractile force of the abdomen is used to elevate the diaphragm. Many men normally breathe diaphragmatically, whereas few females do. See also diaphragmatic breathing. Abdominal breathing. Abdominal cavity. The liver, gallbladder, ascending colon, cecum, appendix, stomach, spleen, transverse colon, descending colon, small intestine, sigmoid colon, bladder. Liver, gallbladder, ascending colon, ascending colon, cecum, appendix, stomach, spleen, transverse colon, descending colon, small intestine, sigmoid colon, bladder. Abdominal cavity, ABDOMINAL, abdominal, cavity, 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 abdominal cavity, the space within the abdominal walls between the diaphragm and the pelvic area, containing the liver, stomach, intestines, spleen, gallbladder, kidneys, and associated tissues and blood and lymph vessels. Abdominal cavity, the space within the abdominal walls between the diaphragm and the pelvic area, containing the liver, stomach, intestines, spleen, gallbladder, kidneys, and associated tissue and blood and lymph vessels. Abdominal cavity. Abdominal decompression, ABDOMINAL, decompression. Abdominal decompression. Abdominal decompression. Abdominal. decompression. Abdominal decompression. An obstetric technique to reduce pressure of the abdomen during the first stage of labor. The abdomen is enclosed in a chamber that permits surrounding pressure to be controlled. Abdominal decompression. An obstetric technique to reduce pressure on the abdomen during the first stage of labor. The abdomen is enclosed in a chamber that permits surrounding pressure to be controlled. Abdominal decompression. Abdominal delivery. Abdominal. Abdominal delivery. 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 Abdominal delivery. abdominal. Abdominal delivery. 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 The delivery of a child through a surgical incision in the abdomen. See cesarean section. Abdominal delivery. Cesarean section. Abdominal examination. Abdominal. Abdominal examination. 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 Abdominal examination. The physical assessment of a patient's abdomen by visual inspection and the use of auscultation, percussion, and palpation. Visual inspection of the normally oval shape of the abdominal surface while the patient is supine may reveal abnormal surface features indicating effects of disease or injury. Subsurface tumors, fluid accumulation, and hypertrophy of the liver or spleen may be observed as an abnormal surface feature. Osculation may reveal vascular sounds that provide information about arterial disorders, such as aortic aneurysms, as well as bowel sounds that are indicative of intestinal function. If the patient is pregnant, osculation can detect the fetal heartbeat and the circulation of blood in the placenta. Percussion involves gently striking the abdominal wall at various points to produce vibrations. The vibrations in turn help detect the condition of internal organs. In palpation, indirect exploration of the abdomen is performed by employing the examiner's sense of touch to detect areas of the tenderness or rigidity, muscle tone and skin condition, and shapes and sizes of subsurface organs. Abdominal fistula. Abdominal fistula. Abdominal. Abdominal fistula. 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 Abdominal fistula. Abdominal. Fistula. 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 An abnormal passage from an abdominal organ to the surface of the abdomen. In the colostomy, a passage from the bowel to an opening on the surface of the abdomen is created surgically. Abdominal fistula, an abnormal passage from an abdominal organ to the surface of the abdomen. In a colostomy, a passage from the bowel to an opening on the surface of the abdomen is created surgically. Abdominal fistula. Abdominal gestation. Abdominal. gestation. Gestation. Abdominal gestation. The implantation of a fertilized ovum outside of the uterus but within the peritoneal cavity. See also ectopic pregnancy. Abdominal gestation. Ectopic pregnancy. Abdominal gestation. The implantation of a fertilized ovum outside the uterus but within the peritoneal cavity. See also ectopic pregnancy. Abdominalgia. 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 Latin abdomen, belly, Greek algos, pain, a pain in the abdomen. Abdominalgia. 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 Latin abdomen, belly, Greek algos, pain, a pain in the abdomen. Abdominal girth, abdominal girth, abdominal girth, abdominal, abdominal girth, girth. The circumference of the abdomen usually measured at the umbilicus, belly button, navel, abdominal girth. Abdominal hernia, abdominal, abdominal hernia, hernia, hernia. Abdominal hernia, a hernia in which a loop of ball protrudes through the abdominal musculature, often through the site of an old surgical scar that has been stretched and thinned, also called ventral hernia. See also hernia. Abdominal hernia, a hernia in which a loop of ball protrudes through the abdominal musculature, often through the site of an old surgical scar that has stretched and thinned, also called ventral hernia. See also hernia. Abdominal hernia, hernia. Abdominal hysterectomy, abdominal. Abdominal hysterectomy, hysterectomy. Hysterectomy, abdominal hysterectomy. The excision of the uterus to the abdominal wall, also called abdominal hysterectomy. Abdominal inguinal ring. Abdominal inguinal ring. abdominal. Abdominal inguinal, inguinal ring, ring, ring. Abdominal inguinal ring. An opening of the inguinal canal on the abdominal wall through which the male spermatic cord and the female round ligament pass. The deep abdominal inguinal ring is marked by an oval depression on the deep aspect of the anterior abdominal wall, just above the inguinal ligament. The superficial abdominal inguinal ring is a triangle-shaped opening in the aponeurosis of the external oblique muscle. Abdominal muscles, abdominal, abdominal muscles, 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 abdominal muscles. The set of muscles that make up the ventral abdominal wall, including the external oblique, obliquus externus, abdominis, internal oblique, obliquus internus, abdominis, transversalis, transversus abdominis, rectus abdominis, and pyramidalis. Broad and thin, the external oblique muscle is the largest and most superficial of the abdominal muscles. It is situated in the lateral and ventral walls of the abdomen. The internal oblique muscle is also situated in the lateral and ventral walls of the abdomen, but is smaller and thinner. The transversus abdominis is the most internal of the flat muscles of the abdomen. The rectus abdominis is a long flat muscle that runs the entire length of the front of the abdomen. The pyramidalis is a small triangular muscle at the bottom front of the abdomen. The abdominal muscles compress the abdominal contents during urination, defecation, vomiting, parturition, and forced expiration. Abdominal muscles, abdominal, muscles. Abdominal muscles. Abdominal nephrectomy. Abdominal, abdominal, abdominal nephrectomy, 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 abdominal nephrectomy. Latin abdominis, belly, Greek nephra, kidney, ectomy, cutting out. The surgical removal of a kidney through an abdominal incision. Abdominal nephrectomy, the surgical removal of a kidney through an abdominal incision. Abdominal nephrectomy, the surgical removal of a kidney through an abdominal incision. Abdominal pain, abdominal, abdominal pain, pain. Abdominal pain, acute or chronic localized or diffuse pain in the abdominal cavity. Abdominal pain is a significant symptom because its cause may require immediate surgical or medical intervention. The most common causes of severe abdominal pain are inflammation, perforation, and an intra-abdominal structure, circulatory obstruction, intestinal or ur- ur- uteral obstruction, or rupture of an organ located within the abdomen. Specific conditions include appendicitis, perforated gastric ulcer, strangulated hernia, superior mesenteric arterial thrombosis, and small and large bowel obstruction. The differential diagnosis of the cause of acute abdominal pain requires its localization and characterization by means of light and deep percussion, osculation, palpation, and abdominal, rectal, or pelvic examination. Direct physical examination may be supplemented by various laboratory and radiologic examinations. Aspiration of peritoneal fluid, paracentesis for bacteriologic and chemical evaluation, and is sometimes indicated. Conditions producing acute abdominal pain that may require surgery include appendicitis, acute or severe, and chronic diverticulitis, acute and chronic cholecystitis, cholelithiasis, acute pancreatitis, perforation of a peptic ulcer, various intestinal obstructions, abdominal aortic aneurysms, and trauma affecting any of the abdominal organs. Gynecologic causes of acute abdominal pain that may require surgery include acute pelvic inflammatory disease, ruptured ovarian cyst, and ectopic pregnancy. Abdominal pain associated with pregnancy may be caused by the weight of the enlarged uterus, rotation, stretching, or the compression of the round ligament, or squeezing or displacement of the bowel. In addition, uterine contractions associated with premature labor may produce severe abdominal pain. Chronic abdominal pain may be functional or may result from overeating or excessive air swallowing, aerophagia. When the symptoms are recurrent, an organic cause is considered. Organic sources of abdominal pain include peptic ulcer, hiatus hernia, gastritis, chronic cholecystitis, and cholelithiasis, chronic pancreatitis, pancreatic carcinoma, chronic diverticulitis, intermittent low-grade intestinal obstruction, and functional indigestion. Some systemic conditions may be responsible for abdominal pain. Examples include systemic lupus, erythematosus, lead poisoning, hypercalcemia, sickle cell anemia, diabetic acidosis, porphyria, Tabes dorsalis, and black widow spider poisoning. Abdominal pain, abdominal abdominal pain. Abdominal paracentesis. Abdominal paracentesis. abdominal abdominal paracentesis, Latin abdominis, belly, Greek para, near, centesis, puncturing. The surgical puncturing of the abdominal cavity to remove fluid for diagnosis or treatment. Abdominal paracentesis. The surgical puncturing of the abdominal cavity to remove fluid for diagnosis or treatment. Abdominal pregnancy. abdominal, abdominal pregnancy. pregnancy, pregnancy. An extrauterine pregnancy in which the conceptus develops in the abdominal cavity after being extruded from the fimbriated end of the fallopian tube, or through a defect in the tube or uterus. The placenta may implant on the abdominal or visceral peritoneum. Abdominal pregnancy may be suspected when the abdomen has enlarged but the uterus has remained small for the length of the gestation. Abdominal pregnancies constitute approximately 2% of ectopic pregnancies and approximately 0.01% of all pregnancies. The condition results in perinatal death of the fetus in most cases, maternal death in approximately 6% because of its rarity. The condition may be unsuspected and diagnosis is often delayed. Ultrasound or X-ray visualization showing gas in the maternal bowel below the fetus is diagnostic of the condition. Surgical removal of the placenta, sac, and embryo or fetus is necessary if attached to the posterior part of the tube. Ovary, broad ligament, and uterus. The procedure is often complicated by massive bleeding, and because the placenta tends to adhere firmly to the peritoneum and to the bowel, complete removal is seldom possible. Allowing it to be absorbed presents fewer problems. Postoperative sequelae may include retained placental tissue infection, continued bleeding, and sterility. Abdominal pregnancy. ABDOMINAL. PREGNANCY. Abdominal pregnancy. Abdominal pulse. ABDOMINAL. Abdominal pulse. 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 Abdominal pulse. ABDOMINAL. PULSE. Abdominal pulse. The pulse of the abdominal aorta. Abdominal quadrant. ABDOMINAL. QUADRANT. Abdominal quadrant. Any of four topographic areas of the abdomen divided by two imaginary lines, one vertical and one horizontal, intersecting at the umbilicus. The divisions are the left upper quadrant, LUQ, the left lower quadrant, LLQ, the right upper quadrant, RUQ, and the right lower quadrant, RLQ. Abdominal quadrants. Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. Abdominal regions. Right hypochondriac region, epigastric region, left hypochondriac region, right lateral region, umbilical region, left lateral region, right inguinal region, pubic region, left inguinal region. Abdominal reflex. ABDOMINAL. REFLEX. Abdominal reflex. Abdominal reflex, a superficial neurologic reflex obtained by firmly stroking the skin of the abdomen, normally resulting in a brisk contraction of the abdominal muscles, in which the umbilicus moves toward the site of the stimulus. This reflex is lost in diseases in the pyramidal tract. See also superficial reflex. Abdominal reflex. ABDOMINAL. REFLEX. Abdominal reflex, superficial reflex. Abdominal regions. ABDOMINAL. REGIONS. Abdominal regions. ABDOMINAL. REGIONS. Abdominal regions. The 9 topographic subdivisions of the abdomen, determined by 4 imaginary lines in a tic-tac-toe pattern, imposed over the interior surface. The upper horizontal line passes along the level of the cartilages of the 9th rib, the lower along the iliac crest. The 2 vertical lines extend on each side of the body from the cartilage of the 8th rib to the center of the inguinal ligament. The lines, which are drawn straight or curved in an alternate formation, divide the abdomen into 3 upper, 3 middle, and 3 lower zones. Right hypochondriac, epigastric, and left hypochondriac regions, upper zones. Right lateral lumbar, umbilical, and left lateral lumbar regions, middle zones. Right inguinal iliac, pubic hypogastric, and left inguinal iliac regions, lower zones, abdominal regions. Abdominal splinting, abdominal splinting, abdominal splinting, a rigid contraction of the abdominal wall muscles. It usually occurs in an involuntary reaction to the pain of a visceral disease or disorder or postoperative discomfort. Abdominal splinting, in turn, may result in hypoventilation and respiratory complications, also called guarding. Abdominal splitting. Abdominal sponge. abdominal, abdominal sponge. sponge, sponge. Abdominal sponge. Latin abdominis, belly. Greek spongia, sponge. A special type of gauze pad used as absorbent and covering for the viscera. See also sponge, abdominal sponge. Abdominal surgery, abdominal, abdominal surgery, surgery, surgery. Any operation that involves an incision into the abdomen. Before surgery, many preparations, including a complete blood count and urinalysis, are done. Immediately before surgery, the skin is shaved and cleansed from the nipple line to the pubis. Food and fluids by mouth are withheld for a period before surgery. After surgery, the nurse ensures that the airway is patent, checks tubes and catheters, connects drainage tubes to collection containers, and checks the dressing for excessive bleeding or drainage. Close observation of vital signs is essential. A careful record of fluid intake and output is kept. The patient is turned and is helped to breathe deeply every hour, and if secretions are present, to cough. Medication is given as needed for pain relief. Some kinds of abdominal surgery are appendectomy, cholecystectomy, colostomy, gastrectomy, herniorrhaphy, and laparotomy. See also acute abdomen laparotomy. Abdominal wound, abdominal, wound, wound, abdominal wound. A break in the continuity of the abdominal wall, a wound that exposes or penetrates the viscera, raises the danger of the infection or peritonitis. Abdominal wall wound, a break in the continuity of the abdominal wall, a wound that exposes or penetrates the viscera, raises the danger of infection or peritonitis. Abdominal, abdominal, abdominal. A combining form meaning abdomen, abdominoscopy, abdominal thoracic, abdominal. Abdominal cardiac reflex, abdominal cardiac. abdominocardIac, reflex, reflex, abdominal cardiac reflex, an immediate involuntary response of the heart to stimulation of the abdominal viscera. The reflex is mediated through the vagus nerve. Abdominal cardiac reflex. Abdominal cardiac reflex, and an immediate involuntary response of the heart to stimulation of the abdominal viscera. The reflex is mediated through the vagus nerve. Abdominal sciasis. abdominocyesis. Abdominal sciasis, an abdominal pregnancy. Abdominal sciasis, abdominal pregnancy. Abdominal genital. abdominogenital, abdominal genital. Pertaining to the abdomen and reproductive system. Abdominal genital. Pertaining to the abdomen and reproductive system. Abdominal hysterectomy, abdominhysterectomy, abdominal hysterectomy. Hysterectomy through an abdominal incision. See hysterectomy. Abdominal pelvic cavity. Abdominopelvic. Abdominal pelvic cavity. The space between the diaphragm and the groin. There is no structurally distinct separation between the abdomen and the pelvic regions. The space between the diaphragm and the groin. There is no structurally distinct separation between the abdomen and the pelvic regions. Abdominoplasty. 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 A surgical procedure to tighten the abdominal muscles, also called tummy tuck. Abdominoplasty. Abdominoplasty. A surgical procedure to tighten the abdominal muscles, also called tummy tuck. Abdominoscopy. 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 Latin abdomen, Greek scopine to view. A procedure for examining the contents of the peritoneum in which an electrically illuminated tubular device is passed through a trocar into the abdominal cavity, also called peritoneoscopy. See also endoscopy, laparoscopy, abdominoscopy, a procedure for examining the contents of the peritoneum in which an electrically illuminated tubular device is passed through a trocar into the abdominal cavity, also called peritoneoscopy. See also endoscopy, laparoscopy. Abdominal scrotal. Abdominoscrotal. Abdominal scrotal. Pertaining to the abdomen and scrotum. Abdominal scrotal. Pertaining to the abdomen and scrotum. Abdominal thoracic arch. Abdominothoracic. Abdominal thoracic arch. Abdominal thoracic arch. The lower boundary of the front of the thorax. Abdominal thoracic arch. The lower boundary of the front of the thorax. Abdominal vaginal. Abdominal. Abdominal vaginal. Pertaining to the abdomen and vagina. Abdominal vaginal. Pertaining to the abdomen and vagina. Abdominal vesicle. Abdominovesical. Abdominal vesicle. Abdominal vesicle pertaining to the abdomen and bladder. See abdominal cystic. Abdominal vesicle. Abducens. Abducens. Abducens pertaining to a movement away from the median line of the body. Abducens pertaining to a movement away from the median line of the body. Abducens. Abducens. Drawing away, pertaining to a movement away from the median line of the body. Abducens muscle. Abducens. Muscle. Abducens muscle. The extraocular lateral rectus muscle that moves the eyeball outward. Abducens muscle. The extraocular lateral rectus muscle that moves the eyeball outward. Abducens nerve. Abducens. Abducens nerve. 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 Abducens nerve. Latin abducere, to take away. Either a pair of the 6 cranial nerves, it arises in the pons near the 4th ventricle, leaves the brainstem between the medulla oblongata and pons, and passes through the cavernous sinus and the superior orbital fissure. It controls the lateral rectus muscle, turning the eye outward, also called abducens nerve, nervus abducens, 6th cranial nerve. Abducens nerve, lateral rectus muscle. Abducens nerve, lateral rectus muscle. Abducens nerve. Abduct, 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 to move away from the median plane of the body. Abduct, 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 to move away from the median plane of the body. Abduction, abduction, abduction. Latin abducere, to take away, movement of a limb away from the body. Compare adduction. Abduction, a movement of a limb away from the body. Abduction boots. abduction, abduction boots. boots, boots. Abduction boots. A pair of orthopedic casts of the lower extremities available in both short leg and long leg configurations, with the bar incorporated at ankle level to provide hip abduction. Abduction boots are used for post-operative positioning and immobilization after hip adductor releases, and for promotion of proper positioning during healing after surgery to repair structures in the lower extremities. Abduction boot. Abductor, 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 a muscle that draws a body part away from the midline or one part from another. Compare adductor. Abductor, 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 a muscle that draws a body part away from the midline or one part from another. Compare adductor. Abembryonic, 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 opposite the position of the embryo. Abembryonic, opposite the position of the embryo. Abernethy sarcoma, Abernethy's, Abernethy, sarcoma, sarcoma, sarcoma. John Abernethy, British surgeon, 1764 to 1831. A malignant neoplasm of fat cells usually occurring on the trunk. A malignant neoplasm of fat cells usually occurring on the trunk. Sarcoma, sarcoma, sarcoma. Aberrant, 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 aberrant. Latin aberrare, to wander. 1. Pertaining to a wandering from the usual or expected course, such as various ducts, nerves, and vessels in the body. Pertaining to a wandering from the usual or expected course, such as various ducts, nerves, and vessels in the body. 2. In botany and zoology, pertaining to an abnormal individual, such as certain atypical members of a species. In botany and zoology, pertaining to abnormal individuals, such as certain atypical members of a species. Aberrant, aberrant, aberrant. Aberrant goiter, aberrant, aberrant. Goiter, goiter, goiter. An enlargement of a supernumerary or ectopic thyroid gland. Aberrant goiter, an enlargement of a supernumerary or ectopic thyroid gland. Aberrant goiter. Aberrant ventricular conduction. Aberrant, aberrant, ventricular, ventricular, conduction, conduction, aberrant ventricular conduction. AVC, the temporary abnormal intraventricular conduction of a supraventricular impulse. It is usually associated with a change in cycle lengths. QRS is greater than 0.12 seconds. This conduction pattern is fairly common after a very premature atrial beat and during the paroxysmal supraventricular tachycardia that is caused by orthodromic circus movement tachycardia using the atrioventricular AV node integratedly and an accessory pathway retrogradely. also called aberrancy, aberrant conduction, ventricular aberration. Aberrant ventricular conduction. Aberration, aberration, aberration. Aberration, aberration, aberration. Latin aberrare, to wander. 1. Any departure from the usual course or normal condition. 2. Abnormal growth of development. 3. In psychology, an illogical and unreasonable thought or belief often leading to an unsound mental state. 4. In genetics, any change in the number or structure of the chromosomes. See also chromosomal aberration. 5. In optics, any imperfect image formation caused by unequal refraction or focalization of light rays through a lens. Aberration. 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 See also chromosomal aberration. 5. In optics, any imperfect image formation caused by unequal refraction or focalization of light rays through a lens. Abetalipoproteinemia. 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 Greek beta, not beta, lipos, fat, proteos, first rank, hema blood, a rare inherited disorder of fat metabolism characterized by acanthocytosis, lower absent serum beta lipoproteins, and hypocholesterolemia. In severe cases, steatorrhea, ataxia, nystagmus, motor incoordination, and retinitis pigmentosa occur, also called Basin-Kornzweig syndrome. Abetalipoproteinemia. Abeyance. 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 A state of inaction or interruption of function. Abeyance. Abeyance. A state of inaction or interruption of function. ABG. ABG, abbreviation for arterial blood gas. ABG, arterial blood gas. ABG, arterial blood gas. ABI, abbreviation for ankle brachial index. ABI, ankle brachial index. ABI, ankle brachial index. Abient, 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 abient. Characterized by a tendency to move away from stimuli. Compare adient, abeyance, noun. Abeyant, characterized by a tendency to move away from stimuli. Ability, ABILITY, ability. Ability, ABILITY, ability. The capacity to act in a specified way because of the possession of appropriate skills and mental or physical fitness. Ability, the capacity to act in a specific way because of the possession of appropriate skills and mental or physical fitness. Ability, ABILITY, ability. Abiogenesis, ABIOGNESIS, abiogenesis. Greek A plus bios, not life, genene, to produce. Spontaneous generation, the theory that organic life can originate from inorganic, inanimate matter. Compare biogenesis, abiogenetic, adjective. Abiogenesis, 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 abiogenesis.